This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses or simply click on the link in our show notes and create an account.
Today we're going to talk about TXA. So what do you guys know about tranexamic acid and when do you use it? So yeah, you can use it in nosebleeds, so you can use it by giving it locally. What else? Traumas, yeah. And so that's kind of the main use that we see for TXA in the department is bleeds, right? Trauma and bleeds. And so the normal dosing, right, is 1 gram initially, and then the next gram over the next 8 hours. So there's a study that just came out, not just came out, but it was out. It's called the CRASH-3 study. Because one of the areas that we were not sure about was its use in TBIs. So does it help when a person has a TBI with a bleed or any type of bleed intracranially? And so CRASH-3 trial was a randomized control trial which looked at patients who had bleeds, intracranial bleeds, and specifically those with traumatic intracranial bleeds. And so they either gave these patients TXA or didn't, and they compared the two. And they found that there was actually an improvement in survival and neurologic outcomes when patients did receive TXA within that window period. And so that kind of answers our question because, we've been wondering, humming and hawing, whether we actually did harm to these patients because were we causing clots and strokes because of giving TXA. So I think now we have good data in a large randomized controlled trial from this CRASH-3 study that allows us to say, yes, if we do have a patient who is having a bleed from a traumatic injury or just specifically bleed, that you can use TXA and it can provide some benefit.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.